Welcome everyone to the session at the Humanitarian Networks Partnerships Weeks. That's 10th of May today, 2022, and we are at the session that is called Health Emergency Response in Interconnected Systems. We have a pretty interesting program today. So we are in a hybrid setting, so we have a number of people over here. You can actually just see that we have some people over here. They can wave or they may not wave. So, so they do wave. So these are real people, not actors or something. So yeah, and let's start. So okay, I'm gonna try to go to the next slide. All right, this is the program for today. This is our agenda. So we have, I think in total, 1, 2, 3, 4, 5, 6, 7 speakers. My name is Mikhail Sirenko, and I'm a postdoc researcher at Delft University of Technology. I'm going to be the moderator of this session. So this is our agenda. So we have some time dedicated to each of the talks here. So each of the presenters will give a talk, then we're going to switch to the next talk, and after we have a Q&A session. Yeah, I think the agenda is pretty straightforward. So I think we can just start. Our first presenter is Gyöngyi Kovács. Sorry for not being able to pronounce this properly, but she will give an introduction to the project because she's the project lead. And Gyöngyi, the floor is yours.
Thank you. I'll come over here. Maybe you see me when you're online. It's wonderful to have everybody here. We are now presenting you things that we haven't yet presented. This HERoS project is now in its 3rd year, and that means that we've done quite a lot of things already. We've had previous presentations a year ago. You can find them on our website as well. This is here to be an update and the freshest, newest, latest results about our project. And if we just now, what is our project about? It's a COVID-19 EU project. We are focusing on all sorts of issues related to the pandemic. We have quite a number of different project partners, and we are very, very particularly happy to have a lot of project partners who are humanitarian organizations, because that's been instrumental for us to know what's going on in the field, collect the data, analyze the data, and from that develop some of the recommendations, results, highlight what is going on. We have 4 main pillars in the project in terms of topics. One is crisis governance, and you will, in that sense, hear today of all of these 4 pillars, because we have 4 work packages around those as well. Another main pillar is about local epidemiological spread, especially how our own behavior contributes to epidemiological spread. We have a 3rd work package, which is very much focusing on medical logistics and supply chains. And there we went from many different topics again, from supply chain disruptions to nowadays also kind of widening the scope to more economic scales, which you will get to hear about today. And then we have another work package about misinformation and fact checking, which is a really important one in today's world with how much misinformation, unfortunately, there also is related to the pandemic. Quickly about the partners, we have some university partners here. I happen to be at Hanken myself at the HUMLOG Institute, but then there is, for example, TU Delft, there is the Open University, and there is Vrije Universiteit Amsterdam. Then we have a number of humanitarian organizations as partners. You find here the Italian Red Cross, you find the Polish Center of International Aid, and you also find Project Hope. So these are the ones that I've highlighted before. And they are all, as said, very much involved in many of these work packages, not just one. Then we have a number of companies involved, especially SQUADRON and the Nordic Healthcare Group, and Arctic, who is also helping us in managing the project. And also the Polish Space Center is involved in helping with a lot of the visualizations and the GIS and things like that. So that's the biggest overview of what there is, and you will find bits and pieces and presenters from the different organizations also joining in today. Welcome, I hope you enjoy and also kind of find it useful what we present as results.
Thank you, Gyöngyi. So that was a very nice and comprehensive introduction. And now we're going to switch to our first presenter, well, second presenter, Cato. The floor is yours. You can now share your screen.
Thank you, Mikhail and Gyöngyi, for the introduction. So my name is Cato Janssen, and I'm a researcher at the Vrije Universiteit in Amsterdam. And I'll present you a bit for you today on the COVID-19 crisis governance, also on behalf of my fellow researcher, Lianne Cremers. And I'll do so through lessons learned from our research, which was in nursing homes. So first off, why did we choose nursing homes as our case study? This is because elderly in nursing homes were very physically vulnerable to the COVID-19 pandemic. Throughout Europe, there was an average of 50% of all COVID-19 related deaths, which happened in nursing homes. And this was only the registered data. So it's clear that many of the deaths that happened throughout Europe happened in the long-term care sector, which makes it ever the more important to research the experiences of members of the sector. So what we did is we wanted to identify lessons learned from effective COVID-19 crisis governance in nursing homes. And we did so throughout Europe by focusing on the capitals of 3 countries, namely Finland, Ireland, and the Netherlands. And what I'll present to you today is a bit of how we conducted our research, but mostly what we found and what the experiences were of members of the nursing home sectors in these 3 countries. So first, a bit on our methods. We used ethnographic fieldwork in 5 nursing homes, which were spread throughout the 3 countries that I just mentioned. In total, we did 68 in-depth interviews and observations in order to get a good view of the lived experiences of our respondents, which consisted of nursing home staff, residents, but also infection prevention specialists of all countries that we involved in our research. And this is because we wanted to make use of a whole of society approach, which means to involve stakeholders from 3 different layers, namely national, regional, and local stakeholders, in order to get a full picture on the experiences of the pandemic throughout these different layers, and present to you the full picture of what happened in order to formulate lessons learned and then eventually move on to policy as well. Moreover, we used participatory action research in the Dutch part of our research, which meant that we went into dialogue with the nursing homes that we visited about what they wanted the research to focus on. So we developed a design together with our respondents and aimed at creating social change through visual methods as well. So what we did is we did 1 month of visual ethnography in the nursing home in order to make a documentary about the research, which we will screen for our stakeholders as well and go into dialogue again in order to show what happened during the pandemic and formulate how we can respond to that all together in the second dialogue. So what I'll present to you now is some of our first findings, and I'll do so by using the words of our respondents, presented here both in text and film, and this is to give you an idea of the lived experiences of members of nursing home sectors. I'll do so through 3 different themes. First, I'll give you more of a general idea of what happened around infection control and what we can learn from that, and then we'll move on to the needs of elderly and the needs of staff specifically. So first, infection control, which I would like to tell you a bit about through the words of a nurse in Finland who told us, I worked in a ward during a COVID outbreak. I just arrived there. I had no idea what to do, how to wear the PPE, or who the residents were. But no one had time for me. They were just so busy. What this shows is that throughout the 3 countries, we found that there was a lot of lack of expertise among nursing home staff, and this was specifically about infection control, which meant they often had to get help from outside in order to use their expertise and respond to the COVID-19 pandemic. So what we think is needed for the future is to provide better infection education amongst nursing home staff in order to have this knowledge within the nursing homes themselves and them not needing to get a response from outside. So second, in infection control, a director in the Netherlands told us one of our employees had worked unprotected and begged for a test. She was told, don't whine, keep working, because that was the policy. She ended up in the ICU and died. This was something that we saw throughout the countries, that there was a lot of lack of protective care, especially in the beginning of the pandemic. And this was because the initial crisis response had a mere focus on hospitals, which led to silent disasters in nursing homes. This also meant that not only a lot of residents died in some nursing homes, but also staff who either ended up in the ICU and, like the person that the director was talking about, died themselves, but there's also a lot of nurses who got long COVID. So in order to prevent this from happening in future pandemics, because we think that nursing home provisioning needs to be included in national healthcare systems so that supply of the necessary gear to respond to infection outbreaks is also provided to nursing homes and not only to hospitals. Next, I want to present to you one of our respondents, a host in the Netherlands, and I would like her to say her words herself rather than me saying them. I hope the video played well for you in Geneva as well. So what this host said beautifully here is that the social isolation in nursing homes led to the serious detriment of older people's cognitive and physical conditions. This could be in the form of detriment in the ability to walk, talk, or remember. And in order to avoid this happening in future pandemics, the visitors ban needs to be avoided at all costs. Many of our respondents in nursing homes expressed that whilst they understood that it was a necessary measure at the time, the visitors ban had such an impact on the residents that it should be avoided at all costs in the future. Moreover, means to digital possibilities for visitors need to be explored more, and there needs to be investment in these digital services in order to if it is necessary again to have a visitors ban, at least residents can see their family online. Next, I would like to share with you the words of a nurse in Ireland who said that there was a dying man who kept on saying, I can't die, I need to see a priest. So in the end, we got the priest on Zoom and the man got his blessing and died 2 minutes after. What we learn from this is that besides the visitors ban, which led to social isolation of residents, many residents also had a very rapid and highly unpredictable detriment if they contracted COVID-19. And this was something that nurses had never experienced before. And because of the social isolation, many residents had to die alone, which left a big scar on both their family members and the nurses. So we think that in the future, infection control during end-of-life care needs to be retaught in order to give residents who do die from COVID-19 the end of life that they deserve, and they can be surrounded by family, or they can see a priest if that is necessary for them. Last, I would like to tell you a bit about the needs of staff as well. First of all, an expert in infection prevention control in Ireland said that there are so many people leaving. Nurses can't take the stress anymore. Plus, they can earn more money at Lidl or Aldi. And what this shows is that the pandemic has put tremendous pressure on the workers of an already overburdened sector. And moreover, the lack of money in the sector means that they are underpaid and overburdened at the same time. So we think it is essential that nursing home education and the profession itself has to be made more appealing, and more money has to be invested into this sector. Last, I want to show you another video of our research, and which is the words of a medical doctor in the Netherlands.
The video is not playing, Cato.
Okay. Do you see the end, or? Well, I think we can move forward. Hopefully you got to see most of the clip, because what the doctor showed beautifully here, so what we could see and hear is that there's alarming levels of trauma and post-traumatic stress disorder among nursing home staff, and these need to be addressed and prevented in the future. So there needs to be serious investment in on-site mental health services, and we need to facilitate group discussions among nursing home colleagues in order for them to be able to share and address their trauma and hopefully process it. And we hope to help them by giving them a voice in our research and by showing you their words through art and film. So in short, for the future, we think there needs to be participatory bottom-up decision-making in order to include the needs of all stakeholders in the crisis response. Moreover, we need to avoid a divide in society and build trust to make sure that everyone is supplied with the right means for infection prevention. Most importantly, we need to strengthen attractiveness of jobs in nursing homes in order to address the serious staff shortages. And we hope to bridge the gap between researchers and policymakers using ethnographic film. Thank you for listening, and I would like to give the floor to the next presenter.
Thank you, Cato, very much. I think this is a great insight into something that we tend to overlook. This is very essential to actually talk to people, to understand what are their needs, what do they feel, and the points that you're making here, they are great, and especially the quotes and what the doctors have said. Yes, to the people who just recently joined, please write down your questions in the chat. We're going to have a Q&A session at the very end. I think you can also think about very nice questions to Cato. All of a sudden, I'm the next speaker. I'm going to talk about something slightly different. Well, actually, something very different. I'm going to share my screen. Just to make sure that everything works smoothly. I think you can see my screen now. Right. Go into the slideshow. Can somebody say that you're seeing my screen?
Yes.
Perfect. This is the title of my talk today, and that's a bit provocative, right? So, I mean, like that, the answer to this question is supposed to be pretty clear to everyone. We don't need to violate anyone's privacy to build better models. But let's try to find out why. And my name is Mikhail Sirenko. I'm a postdoc researcher at Delft University of Technology, and within the HERoS project, together with Professor Tina Komisk, we work on simulation models of COVID-19 spread. Let's go further here. Let's just talk very briefly about what is a computer model. Well, sometimes I think the computer model is sort of like a magical thing that you can ask any question and will give you any answer, right? So, for example, we have this crystal ball, and it's clearly indicating that you have going to have lunch soon. Well, no problems with that. But in reality, it's something slightly different than that. So we can think about the computer model as a black box. We have certain input and we have certain output, and we have no clue what's going on inside, right? So that's specifically relevant for people who are like focusing on the using of the models and not building them, right? So we don't really care what's going on there. Okay, you have your fancy models, machine learning, AI, whatsoever. So I really want to know the answer, right? I'm going to put some input, I'm going to say what I want, and I want to see the output. And so what we did in the HERoS project here together with colleagues from TU Delft, so we built a simulation model of COVID-19 spread that is in the middle. It does some computations, right? It's a black box. And we're trying to figure out whether or not the quality of the input matters here. So what kind of inputs do we have for this simulation model? We have some input on social demographic, on health of mobility of people. And we put that into our black box. It does the job, like brr, 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 whatever computer do. And then it gives us a forecast. Well, and the forecast can be precise, like we have on the slide here. It can be like a number, 335 cases on Monday, COVID-19 infection cases, or it can be not that precise, right? So, and what we're trying to figure out here, like whether or not the high quality data matters here. And we all know that the high quality data, well, it's pretty sensitive, right? We don't want to give up our data to Facebook about like where we were, like why, and things like that. Or in humanitarian context, some data just not available. You just don't have this data of a high resolution, high quality data. It's just not there. So does it really matter, the quality of the input data? Yeah, so this is a central question of the thing that we are doing now. And let me try to reformulate a bit the word quality here into precision. So do we really need to violate people's privacy to build precise models, right? And I'm going to talk in a minute what is a precise model. Let's have here a bit more concrete examples what I'm talking about. So by high quality data, namely microdata, what I mean, you have the map on the left, the blue one, right? And so here we have exact locations where people live. And this is a very sensitive data, right? So you don't want to be identified with a dot on the map with your age, income, like where you work, what do you do for a living, things like that, right? So this is very sensitive microdata. It's called microdata. Our partners from Statistics Netherlands in the secure environment providing us access to that. And we have some alternative over here, the right map on the right, and that's called open data. So with open data, we know only a neighborhood where people live and the privacy is preserved, right? We just like randomly see dots on the map somewhere there with some person of some age and things like that. So, and we have two graphs below. One is for the high quality microdata. And here you see the graph, and the blue line here is just infection, the number of infections, average number of infections over time, number of confirmed cases. And then you have the gray area here, which indicates the confidence interval. So we don't know exact number. We know, let's say, that the number of infections will vary from 0 to 3,000. And the same for the right map. But if we'll try to do a very small trick here, you will share the axis, you will actually see that the differences on the y-axis are like tremendous here, right? So the confidence interval for the high quality microdata is much smaller. So we really know what's going to happen, like, you know, with a smaller band here. And so for open data, we are not that sure. So the number of infections, something like from 0 to 60K. So that's a pretty big gap over here. So this is the kind of difference that we want to investigate. So, and what we kind of like found out, these are the preliminary results. We also, again, we have to graph, sorry for that. So the graph on the left trying to contradict data and precision. So let's say that you have all data in the world, right? So this is one over here. One means like you have all data in the world. So, and then the precision is supposed to be pretty high, right? So it's supposed to like go up to the 1. But what we found out that, you know, the more the precision, at some point, the data stops matter. So there is no, like, nothing changes anymore, right? So you just like, you can add more and more and more data, but the result is not changing anymore. And of course, precision will affect the costs. And by costs, I mean here, like, how much do you need to spend on the policies that you're going to plan? Like, do you need to have some expensive policies that will take into account all plausible scenarios or not? Yeah, so this is sort of like the trade-off here. So X data will give us Y precision, but at the price of privacy. And the same happens with the precision. So Y precision will give us Z costs, but again, at the price of the privacy. So we found out that at some point, microdata doesn't increase the precision of the model, right? So we really need to find this tipping point where, first of all, it does really matter. And then, like, given the fact that the future is uncertain, we really have to focus on using open data and designing robust policies, right? We still, the data that we use in the model, this is just one source of uncertainty, right? Some other sources of uncertainties, like, you know, like virus parameters, or what people actually gonna do, right? Given the new virus parameters, we're not there tired, we're not there like tend to riot or whatsoever. This is also unknown. Yeah, so we have to focus on using open data and design a robust policy that account for the nearest plausible scenarios. And as a last slide, I would just like to thank my team here and also present you the great team behind the work that we are doing. There are very smiley faces in most of the cases. Yeah, so I think I'm pretty much on time. Thank you very much for listening. You can also find updates about our project on our website. Take a look at the website and also keep an eye on that. On around September, the end of September, our work package is going to publish the report about this topic. Thank you. All right, we're going to get back to the main screen over here. I would like to invite the next speaker. That's going to talk about, again, slightly something different. That's Ira, right?
Yes.
Yeah, that's you. And yes, so.
Can I stand?
Yeah, of course. I'm gonna get the control over the slides. And just a second. Right. I hope I'm the only one who is trying to click the slides. Otherwise, that explains why we have such a mess. Blended format, we're almost there. There's definitely a ghost over here.
Okay, so maybe I can present myself.
Right.
You.
Yes.
Yes.
Absolutely.
Perfect. So hi everyone, I'm Ira Haavisto, and I work in an organization called Nordic Healthcare Group, and we're part of HERoS. We've been mainly working together with Delft with healthcare system analysis. But I'm going to present to you now. It actually links to the, not the previous one, but a bit to the presentation before that. We've done some analysis related to long-term care of elderly in Finland and impact of the social restrictions. So previously we looked a lot at healthcare systems and what kind of impact both COVID had and also what impact social restrictions had right in the beginning of the pandemic. But now we've taken a bit more of a a bit longer term perspective, and we're actually trying also to identify impact in terms of issues such as psychosocial well-being of elderly. And we've been lucky enough to have a really rich data set in Finland, and also in some other countries. There's something called the Vrije assessment instrument in use, which is used in nursing homes and also in serviced housing or facilities for elderly, where it's actually been developed originally to measure the functional ability and cognitive capacity of elderly, to be able to predict when there will be a need for more support or more services. So what we've looked at, and health status here is a very broad definition. So what we've looked at is elderly long-term care in Finland. This for now it's Finland, but we hope and plan to expand the study also beyond Finland. This Vrije is an international assessment tool, so it's also used in several other countries, for example in the Netherlands. So what we looked. Okay, thank you. Yeah. So what the data is quite rich. We actually had over 60,000 elderly in the data who have responded to the instrument and to the questionnaires in the instrument. So what we could do is we could actually look at the data points during the restriction and also pre-restriction. And what we could also do is we could identify control groups from before COVID and look at similar cohorts with similar background characteristics, and see how they responded to the Vrije assessment instrument previously. So what was their functional ability and also their cognitive capacity pre-COVID? Because of course, when you, as we know, when you live in nursing home, your functional ability might decrease, COVID or not COVID. So we could actually find control groups where we could identify what the trend was. I'll just show here to the people in the room. The blue line is then sort of an example now of the control group, and what we looked at was sort of this restriction group. So elderly who lived and responded to this question during the time of restrictions. And we looked at the change. So what was the change for between this restriction group compared to the control groups? Okay, you want to jump? So I'm just going to jump straight into what kind of results we found, because that's probably the most interesting part. So there's almost 80 questions in the Vrije assessment instrument, and maybe also as background still. So we have about 2,000 different facilities involved in the data, and maybe also still as a background. So what we did was we used these 6-month periods. So for the group that were the restriction group, so those who actually responded to the questionnaire during the restrictions. For those, we identified also a time spot pre-restrictions, so that we actually always had two time spots or 2 responses per each elderly person. So some of the results are quite interesting, and maybe this can be reflected upon also if you remember, not the previous, but the one before the presentation before that. So what we could actually identify is that there was a change for several of the indicators.
Już napisałam, że wyjdę, dołączę.
Okay. So we could particularly identify changes in the psychosocial well-being. So questions that related to, for example, involvement in life of facility, and also whether the elderly establish their own goals, and then maybe evidently also the personal contact with family or friends. There was a big change, sort of restriction time and no restriction time. We could also identify for the functional sort of for the functional ability and also for the activity. We could identify a change in terms of physical activity outside of the facility. But what's maybe very interesting here is also the indicators where we could not identify a significant change, which if you look at the table, that would be now the right row, and now in the top where you can see walking, independent use of toilet, and for example, personal hygiene. So for those kind of indicators, there was no change that could be identified. For mood and behavior, we could identify a change in the decline in social activities, maybe also evident, but we could not identify a change in the depression, mood swings, sleeplessness, complaints, and pain and sadness, for example. So for psychosocial well-being, there were more indicators that had a change than did not. And here we had, as I mentioned, this involvement in life of facility and also this goal setting, but not in the indicators of aggression or conflict. And then if we still continue on with the memory and treatment, so for memory, there was a change identified for the cognitive skills for making everyday decisions. And this was actually, it was a significant change, and it was one of the biggest differences actually for the restriction group and versus the control groups, for particularly that one. But there were other indicators that also represent memory where we could not identify change, and that was, for example, related to remembering name of staff and both short-term and long-term memory, which is quite interesting as well. Then there's, in this RAI assessment instrument, there's also a category of treatment, which is more related to actual doctoral visits and such. And there, maybe also evidently, we could identify that there were less visits by physicians, and there were also less emergency room visits, which I guess can be seen also as a positive finding. And there were no changes in medical prescription. So what we're doing now, is we're looking at that was the last slide. Yeah. What we're doing now is we're looking actually at the changes over time. So we're trying to identify in the data also more time spots. The last one that we have here was 18th September. So we're trying to move forward. Could you go back a few? I can just show you the. Thank you. So it's 18th September 2020, and we want to find for these same patients who are in the restriction group also the third sort of time spot where they would have responded to the same questionnaire, because what we can see now is that the change, depending a bit on the indicator, the change occurs in different time spots. So for example, the cognitive indicator that you just saw, this one starts showing in like week 20. So, but for some other indicators, it takes much longer or shorter time for there to be a change. So what we anticipate is that for some of the indicators where we now could not identify a change, it might be that it just takes longer for it to show. So if there were restrictions for 3 months in the spring, maybe the change or the effect does not show until the next autumn or even a year from then. So this is what we're working on now, and it will be quite interesting to present those results to you then, I hope, another time. But thank you.
Yeah, thank you very much, Ira. I think it's great to hear that more and more attention is given to the people that are in need, that so much research is focused on elderly, nursing homes, vulnerable people, people with disabilities. I think this is very, very important that we have a better understanding how it works from their perspective. And now we have our next speaker, Abdelsalam Hamid Abakar, who is going to talk about assessing economic impact of COVID-19. He is also on site. We're going to use the same setup, I guess. So yeah. Abdelsalam is here, and the floor is yours, and we can start.
Okay, hi to everyone. I'm Abdelsalam Hamid. I'm a researcher at Hanken, HUMLOG. We are part of the HERO, and now we are going to present part of our findings related to the economic impact of COVID and supply chain disruptions, or supply chain disruption as a result of COVID. And there were like several or so many or hundreds or thousands maybe of research on that side, but most of the research just focus on the maybe one side or one dimensions of the economical impact. So we are trying to assess like more than one aspects, so like sales, investment, and also growth of the investment and stock market, beside buyer-supplier relationship, and to see the cascading effect of supply chain disruption. And we've employed different as approach to assess the economical impact, which is approach compared between for example, sales growth in over times, and also investment over times, and stocks over times, and also buyer-supplier relationship. And one of the most interesting thing that when you compare, sometimes you find that okay, local suppliers has severe impact on the, for example, supply chain of the manufacturers rather than global suppliers. So that because of the severe of the restrictions or measures of the government. So it depends on the country. And we have extracted our data or fetched our data from Compustate or Oxford, and also from other database related to our international monetary fund. So for the stock market exchange, and also for what we call investment growth and change on investment. So there are like different database, and mainly our friend or our also partner coming, he's used to or working on this side, statistical analysis and access to the data set. And we have analyzed the data, and got that okay, companies may need to also work more on the suppliers agility. I mean, to move or shift from suppliers to another, because during COVID, if the country decided to go for full closures or lockdown, that's mean completely the supplier will be disappeared and you cannot access it, which is mean you need to think about another. Previously, we were thinking that, okay, getting a new supplier is something hard and expensive. So to build a new relationship, to find a new suppliers and all this stuff. But surprisingly that we found during COVID, the expense or the cost of having a new supplier was not that high. So it was okay. I mean, companies were able to manage and to adjust with the new suppliers. So which is mean that maybe they managed to be more resilient during COVID. Also suppliers, they became more ready and resilient to also to connect and join a new companies or to be partners of a new supply chain. So in terms of investment, sales growth, they were like some, normal outcomes or findings. I mean, it's a minus growth since the fourth quarter 2019 up to the third quarter of 2020. After that, after fourth quarter of 2020, so some of them, they started to recover. So 2021, most of them, they recovered. I mean, most of the companies, most of the indicators of stock market, investment, and sales growth started to grow, and they started to also gain some what we call it revenues, and also to get out of the minus to positive growth. Based on the data that we have accessed, I mean, according to data set, so I think they were like quite surprising results or findings, but that's kind of motivation for maybe new research on those areas. Mainly, we need to think about the resilience and also the adjustment and the old assumptions that we have in supply chain, so which can be changed now after or post-COVID. That's like just a summary or abstract on what we have done related to our work package in HERoS. Thank you so much.
Thank you.
All right. Thank you very much. And I want to point for like being online. You can also access the slides. You can also access the recording of that session later on. So to read more, you can also go to the HERoS website. We have a lot of material there. Please go to the outcomes of the project and you can take a look there. Also, feel free to contact any of the presenters to get to know more. Now we're going to go to our next presenter, who is going to talk about drone simulation of delivering emergency goods. I think it's going to be very, very interesting presentation. So, Greg, please share your screen, and I think we can take a look at the stuff that you did, which is truly amazing.
Okay, thank you very much, but you need to make me the priority, yeah, because yeah, okay, can you see me?
Yes, we can see you. All good.
Okay, thank you very much. My name is Grzegorz Trzeciak, known as Greg, and I'm the member of SQUADRON company, and here in the HERoS project, we are doing the not only simulation about the UAV delivery, but also, as you see, much more. And so regarding the project scope and what we are doing here in the HERoS is first of all, we had to prepare the concept of the unmanned aerial vehicle for humanitarian aid delivery. What was done, we also are programming the ground control station and ground control software for that. And what is very important, thanks to the simulation, we are doing the full logistic chain of for the unmanned transportation in humanitarian aid deliveries. And the initial characteristic of the unmanned aerial vehicles is 150 kilos of payload and 700 kilometers as a range. So you see, we just quit with the small drones. We went to the big drone, but because of the weather and the presentation and certification, etc., we just made a ground control station with the software, and we put everything into the simulation. So I will change the view right now, and right now we are in our control room, and right aside is our ground control station, and I will show you in a minute. Okay, so now you can see. Can you see the ground control station? Or yeah.
Yes, we can see it.
Okay, thank you very much. So so you see here the pilot at work, and there is a view from the camera below, and the status of all crucial elements of the aircraft above. So we are now in Uganda. We started from Karkira airfield, and I will show how it looks like in the simulation. So we also, besides the model of the plane, you can see here the all geographical models, and here in the up of the screen you can see the lake of Victoria. Let me go into the okay. Okay, so and we started from Karkira airfield, and we are going into the biggest humanitarian or refugee camp all over the world, as I read, is a BDBD refugee camp. And if you have several hours, we will you can go with our pilot, and at the end that will be landing. So that's basically the technical part of our job in a HERoS project. But also what we did is also the full scope of humanitarian logistic chain, and I will show you in a minute the initial point for that. This is the workflow of aerial delivery. Like we have here at the left, we have let's say hospital or delivery points activities. In the middle, we have unmanned aerial or airlift flowchart. And at right side, we have a part of, let's say, requesting activities, like, and you can see here the cargo delivery request, and this is the initial point for the UAV mission delivery system activation, cargo hub activation, cargo preparation, container selection, and in the middle, you have some points like landing point selection, delivery method selection, cargo flight, mission request, mission identification, etc., etc. So this is in this project we are not only focused on just technical issues regarding the UAV itself, as you saw on the picture before, but this is very important, extremely important, that not to have just UAV and that's all, but also to support with a full scope of logistic chain of the system, to have the logistic chain of the humanitarian aid activities. And regarding this, we started and writing the 2 documents to help in the future, to help people, to help provide the UAV delivery in humanitarian operations, in humanitarian crisis. One of them is standing, I will show you the draft here to the camera. One of them is standing operational procedures for humanitarian for using the UAV, long-range UAV, in the humanitarian and medical aid in terms of natural disaster, etc., and humanitarian operations. And this SOP is covers the rules of organization of the deliveries, the principle of the organization of the work of flying personnel or technical personnel, also the principles for the forward operating base or logistic operating base or humanitarian aid hub in the theater of humanitarian operations. And also the unloading and or dropping, because as we discovered in during the project, we have there is something like dropping system, which is a new opening for this method of humanitarian aid delivery. So this is also the document we are going to prepare in the project. It is a draft for the further development, and the second document, which is the most important and the crucial for our job in this project, in the HERoS project, is what we call the Convention on Unmanned Aerial Deliveries in Humanitarian Operations. Like this is the draft starting. And right now, this is one sheet of paper and the chapters, because this is the last phase of the HERoS project for us. So that's why we are starting writing the convention. This convention, the draft of the convention, is a milestone in the humanitarian aid delivery, in our opinion, and in the opinion of our partners in the HERoS project, because it opens the gate for organized humanitarian aerial delivery with unmanned aviation all over the world. So this is the draft, and the plan is to move forward after the HERoS project end, because the experience from the simulation, like and the experience from hours of the flight, as you see the pilot Darek, is something like it cannot be just closed regarding the project. The UAV, because we are the UAV guys, so the UAV will go into the humanitarian aid and the COVID is the best example. So they will go there. So they need to be organized, and every country who signed the convention in our mind, every country who or every state who signed the convention will open next step for the unmanned aviation itself. Thank you very much.
Thank you, Greg. That was a really interesting presentation. We're just like having some very minor technical issues.
Remote control TV. Yeah. The
Press
press
volume
button.
something. Press the volume button.
Press any button.
So it doesn't go.
Yeah.
Just a second, and we're gonna go to our next speaker.
Yeah.
All right, it works. Yes, so I just want to point to the fact that you can actually see a lot of different research here. So far, we have covered quite a few topics, right? So we talked about the importance of taking care of vulnerable individuals, elderly, and so how it can be done. I talked myself about the models that we use for predicting the spread of the disease, and this presentation was on the drones, right? So all the things that we have heard about before here, they are connected together. So we can see that the pandemic is a pretty complex issue, right? And it's hard to come up with a single response towards that. We really have to cover that from multiple aspects, right? And that was one of the that's one of the ways to look at that. So now we're gonna take a look at something again slightly different, but which was also very, very important during the pandemic. I think we have seen the different phenomena of spreading the fake news, different things like that, and misinformation across multiple countries. We have now our next presenter here, who is going to talk about monitoring, understanding, and influencing the co-spread of COVID-19 misinformation and fact checks. That's a brilliant title. Yeah, so the floor is yours. So let's start and let's learn something about the misinformation.
Hi, good morning, everybody. So my name is Gregoire Burel. I'm from the Open University, and so I'm just going to talk about the state of misinformation and fact-checking during the COVID-19 pandemic. So just check, yeah. So during the pandemic, there has been a lot of misinformation. I mean, everybody probably experienced it to some degree, although in general might not be very dangerous or bad misinformations, quite a few cases were quite dramatic in their impact. For instance, in the UK, people like set on fire 5G masts. In India, people were attacking people installing those masts. Or in Iran, for instance, there was mass poisoning, alcohol poisoning, because people thought that alcohol could kill the virus. So all that because of misinformation. So as a result, what we observed is fact checkers were kind of starting to spread more and more fact checks. So they were doing much more work than they used to be, and more than 16,000 fact check were published during the last 3 years about that. But unfortunately, they still don't spread as much as misinformations, which is expected. Obviously, misinformation is kind of easy to digest compared to fact check. So what we did, we tried to understand, for instance, in particular, how this misinformation fact check were spreading during the pandemic. And the first step is to understand, to collect data. So what we do is we monitor constantly mention of fact check and misinformations on Twitter. And we do that every day. Basically, we collect data and then we generate reports about the state of those every week. So by monitoring misinformation here, it's important to note that is fact check misinformation. So obviously we cannot monitor everything, and it's very hard to let's say identify misinformation automatically. So we rely on the fact checker to identify them. The second part is to understand. So the key things here we want to know is, do fact check work? So did they actually help reduce the spread of misinformations? And also, who spreads misinformation and fact check? And what are the topics that are most likely, let's say, to remain over times? And the final part, which is to understand if we can influence people about spreading less misinformations, or can we help the spread of fact check over time? So what it means, like, if we push, for instance, fact check to people already spreading misinformation, will they react and change their behavior? Yeah, hopefully. And what type of message might be more successful in doing so? So the first part is to monitor.
Greg, can you
Yes.
please take control? You are not controlling the slide.
Okay, I've been moving slides though, so they don't move. Okay.
No, because you are not controlling.
Okay, I just noticed that. Sorry about that.
Yeah.
So I didn't see many things then, I guess. So I was there anyway. So what happened? So we monitor misinformation and fact check. So we're doing that for the last few years. And as I was saying, we generate reports about them. And those reports are useful because they give you like a snapshots every week about what has been going on during the last week. And they can be used particularly, for instance, for organization or fact checker to know, for instance, what misinformation still spreads despite the effort to deal with it, or what fact check has been actually successful. And that can help them to kind of adapt their response over time. And yeah, so those reports, which I just said, are automatically generated. They have three types of key content. So one is the information about the top misinformation and fact check in a given week, as well about the topics that are spread the most and so on. And also they've been evolving over time. The second part is information about who has been fact checking it and where they are from, what countries, and so on. And the last part is the impact on demographics. So for instance, is it more organization that spread misinformation, or individuals, or what age group are they from? And that can be used as well to more targeted, say, response if necessary to individuals. So now that we have like all this data, what we want to know is does it work? In fact, does it work? Who is spreading it? Is there different behavior depending on the type of misinformation we observe? And we run this study for a few times now. And here, what I'm going to focus is mostly like what happened since last year, since we published this work. And what we want to know again is what is the relation between the fact check and misinformations. So during two and a half first year of the pandemic, what we observed is that there is a difference in how misinformation and fact check spread. There is causal relations, or weak causations, let's say, between misinformation spread and fact check. So they have kind of means they affect each other. So there is some good news there. So if you see some fact checking, you will see somehow relations to how misinformation behave as a response to it, which is good news. But again, it's not much. And also what we observe is over time, independently of the topic, so it can be like topics about, let's say, virus causes, how authorities handle it, or conspiracy theories or vaccines. They will behave differently at the beginning, but they will tend to converge over time and behave the same way, spread the same way. That's kind of in general what we observe, except for mostly two, which are like causes of the virus. So, like people saying like it was engineered and so on, and also like conspiracy theories related to it. So those, they will tend to still appear over time and reappear, reemerge, and they are much different in the way they behave than other type of misinformation. So what that means is that they should probably be treated differently by a fact checker, for instance, or we should treat that differently compared to other type of misinformation. And if we observe just the last year, so we observe in general the same behavior. So still misinformation spreading more than fact check, and a convergence over time. but now we observe more like a kind of change in behavior towards vaccines and authorities over time. So this still appears. And while before we were observing kind of the change of behavior and the way it was spreading over, like, let's say, like 10 days and so on, now it's much longer. So those might still appear after like 200 days. So that means like they've been appearing all over and they still appear, which is quite sad to see, obviously, because there is fact checks, but they still spread despite those. So know that basically we have understand that fact check kind of work, but they don't spread enough, right? So what can we do about it? So as part of some initial work, what we tried is to push fact check to people spreading misinformations. So what in general we will observe is like individuals are not tech savvy, they will not seek, let's say, to install tools that will help identify misinformations while they are browsing social media and so on, or they will think they don't need them so that's so the idea here is if we push directly to them, they don't have to deal with this. And also a side effect of pushing fact check to people spreading misinformation is that the people that actually look through their feed, they will still see those fact check appearing, but even if they are not the primary target of them. So that's another reason why we do that. And we use like different templates. So basically what we do is we try to send different types of message and see whether there is like a way to communicate those fact check as an impact on people behavior towards them. So they can be like very factual or, for instance, friendly. We can say hi there and things like that. So to make them maybe reacting nicer to them, or like being very alarming. So like, oh, this is kind of you're sharing something not very good and so on. And yeah, so far we have sent more than 700 replies to people sharing misinformations, and as expected, I guess people don't really like them. So they will basically tends to contradict us. So we got quite a few different types of replies from them. So they will reply to us, which actually is useful, and we have done some initial analysis on that. In long term would be very useful to understand more what those people think. But in general, so there is like a distrust. For instance, they will just distrust us straight away because fact checker, like we check the fact checker and things like that, or distrust in government. So they will tweet us back like websites that are known to have views against fact checking in general, or they will say we are paid by big pharma and things like that. So there's quite a few things that we observe. And in terms of behavior, so again, very few positive outcomes so far, but we see kind of common patterns there. So user will reply us and then block us. So that's very common about what we see. So they will tell us something not very nice, very often sarcastic, and then basically block us. And some interesting also behavior, we observe quite a few, is people will delete their post and then block us as well. So again, they might do that because they might not want to be, let's say, caught by the platform that they're sharing misinformations and worried about being blocked, but they don't want us to send them messages again. So that happened. And finally, so there is no clear, let's say, behavior associated with a particular pattern. So that's something that means that we probably need more personal approaches for replying to people sharing misinformation. And so in terms of future directions, so there is quite a few things here. In terms of monitoring, obviously, so we want to kind of update our observatory and as well kind of extend the type of report. So now we have more like a global view of what misinformation is in a given week, but more so for granular, for instance, like tracking individual claims and individual misinformations and how they've been spreading over time. So as we saw earlier, so some have been spreading for more than 200 days and is still there. So why. Really interesting to see. And in terms of understanding, so obviously like continuing doing our analysis, and as more data comes through, updating our analysis and also adding more demographics, for instance, age groups, which we have, but it's not that reliable. So that's why we haven't done it so far. And finally, in terms of influencing behavior, which is kind of our focus now, is to generate more personalized, let's say, replies to people sharing misinformation, and also like perhaps having more visual templates, as visual content tends to be more seen on social media, and also will be more seen by other users, which would be useful, potentially useful as well to reduce misinformation spread. So yeah, that's it for me. So if you have any questions, I mean, let me know. Thank you.
Thank you very much. That was very, very interesting, and it's quite some content over here. So I think that's also very interesting to look at the impact of misinformation on behavior, how people do that. That's really great. I think we are on time, which is absolutely fantastic. Couldn't expect anything like that, given our like very interesting setup, hybrid setup. Thank you very much to all the speakers. And so I think we can start our Q&A session. So if you would like to ask a question, please raise your hand. There is a very nice button, reactions over there. You can raise the hand there, maybe somewhere else. Write the message in the chat, unmute yourself. If you want to, you can use your camera. So the floor is open to questions, and let's just start. Anyone from the audience or anyone online already ready to ask questions?
So we have one question from chat.
All right, amazing. Can the speaker unmute himself or herself and talk?
I know. Can you please do that?
Yeah, sure. Hello. I'm Ina Ruggiero from Hanken, HUMLOG, and my question was for the nursing home research. Yes, what was exactly my question? I will see it also. Yeah, was it easy to get consent for participating in video recording and for using the video materials? So any experiences or insights from that?
Yeah, I think Cato, that's you, right?
Yes, thank you for the question. And it's a very interesting question. And what we noticed is that regularly respondents actually responded very positively to the camera, because they also felt that by us filming them, they would be able to share their stories. And this was also because of the traumas that I explained, and they felt that we could use their stories to kind of like make their suffering heard. There were some people who didn't want to be filmed, but overall, most people were very positive about the camera as well.
Mm-hmm. So you explained that they will be also used in the dissemination of the findings and
yes. So we explained them that we wanted to make an ethnographic film about their experiences and share their stories, and they were often very excited about the idea that there will be a film or a documentary about them. So that also helped in kind of like getting them enthusiastic about the camera.
Mm-hmm. Indeed, very powerful impact it creates when you really see how the interviewees responded. So thank you for that.
Thank you for your question.
So we have one question from the audience, but before that, Sudeepa, can you please stop sharing?
Greg, please.
Yeah, that's great. So we have one question from the audience. Yes, I think we can just go ahead with that.
It's not really a big question, but I know that Cato and Lianne, you've been working on this documentary and it's going to air relatively soon. Can you maybe just also tell us where to get to see it?
Yes, thank you. So we will make sure that the link to the documentary is also on the HERoS website that Mikhail shared, and it's going to be streamed on Vimeo.
I have a question.
And can I add something to that? Because we will also screen it at several live events. And we want to embed the ethnographic film in a publication that we want to publish in a peer-reviewed scientific journal.
Yeah, that's great to hear. That's great to hear. Thank you. So please follow up on the website for the film and the Vimeo platform. So we have a couple of more questions in the audience. So we're going to switch to that part of our room. Group. Yeah, so go ahead.
Thanks. Hi, everyone. Hi. This is a very intimate session. I love it. My question goes to Greg. So my name's Sirenko. I work for a medical devices company. So therefore, absolutely no experience with drones or aviation. But I have to say the project is absolutely mind-blowing. I think it's just amazing, the work that's been done. And it's really going to shape and change our future. So Greg, my question is probably very simple. So ignore my, I hope it's not a stupid question, but just listening to the facts that you shared about the drone itself. So you mentioned it can carry 150 kilos. I think it can go 700 kilometers. Was that right? Did I get that bit right?
Yes,
excellent.
that was the initial, yeah.
So how high can it go in the sky, and are there any restrictions with regards to air zones, airspace zones?
This is the very good question. That's the very good question, because this is the base of our presence in the HERoS project. So long story short, this is not a technical problem to take 150 kilo from one point and deliver to other. Whatever it means, 100 kilometers, 500 kilometers, 700 kilometers, 1,000 kilometers. This is not a technical problem regarding the UAVs. This is the organization problem. It means that's why the SOPs, the standing operational procedures, and the convention draft came to alive as a drafts to be a result of this project, because all the country which seeks or which is for example in the danger of humanitarian crisis needs to have the clear framework to know what to do regarding the UAV deliveries. And as you saw, this is maybe you cannot see, but this is not a small UAV. This is not a small plane. It's around 7 meters of the wingspan. Which means they need special corridors. They need special permissions. They need the communication links. That every organization or aspect regarding the UAV delivery in humanitarian aid is as a result of the simulation and as a result of the project in convention and standing operational procedure draft. So right now we have around 120 something flight hours in the simulated environment. So this is a huge experience, practical experience to write the organization for those flights, because you saw the only one plane. But imagine, for example, the airlift, like 25 or 50 planes in the same time in the air. So this is the let's say huge organization effort and technical effort. So we are not focusing just only flying from one point to the second. Okay, is that the answer for your question?
Yeah, absolutely. There's just the last one, just following on from that. When do you foresee? I'm taking up all the space here. When do you foresee the actual project, being executed, going into action?
Okay, that's also a very nice question. Yeah, because our approach in the in the HERoS project was like, okay, everyone is building the drones right now. Okay, almost everyone is doing the drones. So what to do to have something significant and just do the step forward? That's why we developed the full scale or and very simple ground control station, which is a heart of the UAV system. Okay, and we left the plane itself to find as a result of the meetings during the project, etc. And by the way, this is not a secret, but we found the investor who is ready to put the money into the plane construction itself, but the request is 500 kilos of payload, means half a ton.
And then very, very last question, I promise. You mentioned investor. Is it a secret then to tell us how much money it takes to actually cost, run, and build a UAV?
A lot, because this is a plane which is going under the normal aerial certifications, which means every part, every spin, every pin in this aircraft, the price you need to count by 4 because you need to certify as a real airplane.
Oh,
So
okay.
so that's also the problem. Yeah? But a lot. But if you have some, okay, we are welcome. You are welcome in this project. Okay, we are looking for the pilots in the 1 year. Yeah?
Thank you.
All right, thank you very much for this this question. Any other questions in the audience or online? Happy to hear you speaking out.
Gregoire, just it's a maybe silly question, but were the intentions behind the fake news or fake facts about COVID? So did you just find anything that like intentionally has been planned and intentionally has been spread as fake news or factors or fact?
There is quite a few research that address this pro in particular. I mean, it's not something we investigate directly here. There's been cases, I don't have the paper here to tell you which research exactly, but yeah, there has been cases of that happening. So, I mean, in general, there is some research method that shows that very few people actually spread or generated, initialized the misinformation. What we did here is more like a global view of the misinformation spread and topic related rather than individual, even if we have this data. I mean, that's kind of something we want to kind of look more in future, like at the individual levels, in particular, like in terms of the observatory to increase, let's say, to add more types of reports more at the individual levels. So we'll be able to track this type of problems.
Thank you for the answer. I guess I'm going to ask my questions as well. So maybe I'm going to perhaps ask first Cato and Ira. I think that's great that the research that you're doing, it's really, really great. And it's very important to take care of people who are like vulnerable, who have disabilities. And I'm wondering whether or not the people with whom you worked, well, with Ira it's a bit more complicated because no direct, like, interaction with people like that, whether or not they addressed some specific like requests, like what kind of policies they would like to have, like what do they want, or it's more like a, like we're experiencing some struggles and we don't know what we want. Maybe Cato, you can start, and maybe you also have something to say.
Yes, thank you. Yeah, that's a good question. And actually what we found was that the nursing home staff, they expressed that they really wanted some collective efforts within the nursing home to talk about what they experienced during the pandemic. So that's also why we said that we need to facilitate more group discussions. That was really something that came from our respondents themselves, because they felt that talking to us was already a way of kind of like sharing their trauma, and they expressed that was their first, sometimes it was their first time where they really looked back upon specifically the first few months of the pandemic, and that helped them in realizing the things that they experienced. So yeah, definitely the sharing part is something that came from them. And then also the lack of protective gear, that's something that all of them said, like if we are ever in this situation again, then we can't have that we're not supplied with enough gear to protect ourselves and our colleagues.
No, thank you. Ira, maybe you have something to add? Like what kind of actions do we need to take to perform better, like with nursing homes?
Well, I could add in terms of when we gathered the data, sort of the communication with some of the facilities who are involved, they and the staff there. What they actually also say is that nobody sort of believes them, and I guess both the previous comment supports that. So what they would want is also this kind of research that actually really shows what happened, and both in terms of the staff and their needs, and also the needs of the elderly, because so far it's more just sort of a sense or a feeling or media who says what has occurred in the facilities. So what they really want and wait for and long for is that we come with some hard evidence, and what the policies will be when we have that. I couldn't say that yet, but at least from this data that we see now is that that there's sort of it's not so that the elderly in facilities have been sort of miscared for, or that there has been sort of very negative impact throughout, like in each category or in each sort of category of well-being, particularly now that we're looking at it, but it's some specific ones where we can really see a big impact. And of course, the policies in the future should then focus on those. For example, now if I look at this data that we have, then that would be the cognitive capacity, and how to support that better in situations in the future if we end up with either a pandemic situation or then also a situation of restrictions.
Great, thank you very much. Yeah, thank you. Yeah, we are slightly, like we are almost done in terms of time. We still have some quiet people there. Thank you very much for this great session. Thank you, presenters. I liked very much the stuff that we did together today. And I also just like maybe a short reflection on this kind of answer from Cato and Ira. I think it's great. One of the things that I really like about the HERoS project is that we have practitioners together with academics working, again, trying to get to the ground, actually like speak to the people, right? Because in academia, like you always, that's where I work, right? I work in university, you tend to overlook these things. This is like amazing, really, really great. Again, thank you very much. I think you have all our social media in the chat, so please follow Twitter account of the HERoS project for fast updates, and you also have the link to the website. We're going to put the deliverables there. Get in touch with us. Yes, and I hope that you had a great session today. Thank you very much.
Thank you. Thank you.
Thank you.
Yes, we are done. Yes, we're gonna wrap it up here. I think Sudiba, you can stop recording.